A patient presents to the emergency with chest pain. We are all aware that every chest pain is not a heart attack. However, it could potentially be a heart attack. And even in a heart attack, the initial investigations may be normal. The common investigations such as ECG, which is simple bedside test, may not show striking changes in the beginning, though it is a heart attack in process. Now, would you send a patient back home just because one ECG is normal? In such a case, we will be exposing the patient to a danger of worsening heart attack or even death outside the hospital. Therefore, recommendations, guidelines mandate that such patients should be kept in the emergency room. They should have multiple ECGs recorded at half an hour intervals if they have continuous chest pain. If the subsequent ECGs show new changes, then the patient should be treated as an evolving heart attack. If the ECGs are normal, the patient should have an echocardiogram done, which is a scan of the heart, ultrasound scan of the heart, which may pick up changes that the ECG has not picked up. This should be complemented by blood tests, what are called cardiac enzymes, particularly troponin. These are very sensitive markers of heart muscle injury, but they start rising only after a few hours of the heart attack process starting. That means the initial troponin may also be normal. So you have to repeat a troponin at least 6 hours after the first set of troponin is checked. If at the end of 6 hours, if all the ECGs are normal, if the echo is normal, and if both the sets of troponin are negative, then such a patient may be safe to be subjected to a stress test under controlled conditions. However, if any of these tests in the interim show abnormalities which are indicating an evolving heart attack, then such a patient has to be subjected to an invasive test like a coronary angiography. So just the fact that the initial assessment in terms of ECG or cardiac enzymes turned out to be negative does not mean that the person does not have an ongoing heart attack, because the initial test may not pick up the problem. So a more elaborate assessment may be necessary in some situations particularly where because of the nature of chest pain or because of the patient's risk factors such as smoking or diabetes or blood pressure, if the doctor is suspecting that there is a high probability that this event may be a coronary event, then he may need to do more number of tests to be very sure before sending the patient back home. Because as you will all understand, missing a heart attack can be very dangerous. It could be fatal for the patient.